colors are very important, especially in we're talking about restoration, and especially for anterior teeth. Central incisor is the most common to be discolored fracture because it's over here, and the trauma will be over here, and you saw one of the structure. He's missing central incisor, but for many years he doesn't care. Until we made one for him. So tooth color is fundamental in dentistry. You have to know physiology, physics of the coloring, absorption, interaction with light, and you have to know anatomy of the tooth, enamel, dentin, pulp, and the optics. Optics is a big class. When I was studying laser, optics was a big thing about refraction, reflection, and all these things. And so the tooth, the most important thing, part of the tooth is enamel. The problem with enamel will never grow back. When you fracture it, when you get decay, the enamel will never grow back. And then the enamel is is on the face, especially anterior teeth. I should take a picture of anterior teeth. And the dentin is more yellowish than the enamel. The dentin will support the enamel. The enamel, although it's the hardest material in the body, it's brittle, so it needs cushioning from the dentin. The dentin is a living tissue, has a blood supply, and there is a odontoblast all lined all over the dentin from here, and will continue to produce more dentin, and they grow back. So then the dentin will grow, and the dentin is yellow in shape. And the dentin is sensitive. It's almost yellow, it's not 100% yellow. And there's the pulp. The pulp, because of the dentin will grow, the pulp will get smaller with age. So, and even the sensation of people, the pain threshold increase with age because the pulp will be smaller. The cementum will cover the root. We never have experience with the cementum because once gum recession, the cementum is very brittle. It will break out, and we have exposed dentin. And exposed dentin will be sensitive. So most of the time, if you have a gum recession, Israeli we do surgery to gingival graft. Most of the time, we make the crown a little longer to cover the root. And cementum. This is the pulp, gum, gingiva. Gingiva doesn't look like this. The gingiva, this one. Gingiva would be like this. There's a gap here. Gingival sulcus. So most of the gingiva would be like this. And there's a free gingiva, there's a tagged gingiva, and they both keratinize, but they are different physiology. So the gingiva is also important. So when we do crown bridge, we do the finishing line. Ideally, the finishing line should be subgingival, supragingivally to be clean, but most of the dentists would do subgingival. We do it subgingivally to be aesthetically more acceptable. So we do retraction cords, extraction cord to push the gum away. So the enamel, outermost, most semi-translucent, central incisor. The tip of central incisor is almost translucent because it's just enamel. There's no dentin. Hardness of the human body, thickness, translucent, effluence, and dentin is the second layer, yellowish in hue, primary contributor. Dentin is of acetate color vary among individual. Yeah, individual and age. Told you, with age, we have more dentin, and we have sometimes dentin. It has a reaction to decay, trauma. If there's a decay, there's more dentin. If there is a abrasion, erosion, especially attrition because of pressure, there will have more dentin as a reflection to the damage to the tooth structure. We grow more dentin. Pulp is important because sometimes people will get hit on their on central incisor. There will be bleeding inside from the pulp, and some of the blood are red blood cells will go inside the dental tubule. They will look red in the first few days, then become blue, and then become dark. And most of the time, the pulp would be died because of the trauma, and we end up with a tooth looks like blue. Remember the king of Norway and the Hillary Bluetooth? That's they call. Anyway, they call the Bluetooth thing about his name, about Bluetooth technology. Cementum is covered the root. It's very thin. Cementum is very thin. It's will cover the root here, and it has attached to the periodontal ligament. So, what factor that influence color? Genetics. Some people have whiter teeth. Some races have whiter teeth than other people. Some, if you will technically you will inherit your tooth color. Enamel is thin over time. Enamel will lose it with time, and once you lose it, that's it. But also the dentin, and also attrition can also wear and reduce the. And there is a crack. Always there will be cracks. Sometimes you can see it visible when a special light, especially when you use a light cure device on the tooth. You can see there's a crack. Dentin will continue to grow through life and vitality, because if it's non-vital, we made the root canal, the dental will die. That's the thing when when they do the root canal, the tooth become brittle because the dentin will become dried, and it would be will never support the enamel as it used to be. Diet and lifestyle, coffee and tea addiction. Wine, they say, red wine, and but coffee and tea. One of my teachers said tea will stain more than coffee. I think it's not the tea and the coffee, it's the frequency, how much you drink, and the concentration, and if you brush your teeth after that or not. But these are external stain. You can remove them, especially there's chlorhexidine. You know, chlorhexidine mouthwash. One of the side effects is the stain. But in the book, they made a big deal that you can polish it out. It's external stain. The internal stain is more dangerous, like tetracycline medication. Tetracycline, you know, tetracycline, antibiotic. Used to be a very long time they do give it antibiotic. If you give it to child, the teeth are still growing. It has affinity to calcium, so it will be incorporated in bones and teeth. We doesn't care. We don't care about if it's in the bone because no one sees the bone. But if in teeth, it will. I'll show you the picture of the discoloration. We'll see like a bluish or grayish discoloration. You can see that at a certain age. Sometimes child with high fever or specific virus disease, because how the enamel grow. The enamel ameloblast will secrete enamel matrix. It will secrete enamel matrix, go back, secrete another layer, go back, and these layers will calcify, mature. Some diseases, some high fever, will interrupt that physiological effect of making enamel, or even making dentin is also the same. So sometimes in certain diseases, early childhood, and especially when the teeth are growing inside the bone, and when the teeth erupt, you can see there's a line, something wrong with that, because of there's a certain disease happen while the tooth is growing at that time. Or you took some medication like tetracycline, affect the teeth during development. Amelogenesis imperfecta, you can tell. Amelogenesis means enamel making, imperfecta, so not perfect. This is Latin. Or dentagenesis imperfecta, after tooth and color and structure. You can see they have abnormal teeth. Dentinogenesis imperfecta, because almost always they don't have enamel. Imagine because the dentin attachment to enamel will be gone, so the patient lose their enamel cover early. So you just see just teeth, like very small teeth. Anyway, I want to lose this. Okay. So that's optics of tooth coloring. This is the same picture in the laser tissue interaction. That whenever laser or any light, there are these options to go. Either go through what we call transmission or absorbed. And when they absorb the light and reflect the light that we see, that's why we see the colors. We don't know the real color of this object because we hit them with the light. They absorb the colors they like and they reflect. So we can see they're white. They reject the white. They absorb the other ones. That's the thing. Transmission go through, especially in the central incisors, because the tip here is almost all enamel. Reflection, it's also will affect that. And there's another scatter. I don't know why it's not here. Sometimes scattered, especially if you have rough enamel, rough surface, the light will be scattered. Reflection, scattering here, yeah. Scattering is light, diffusion, accretion, transmission, absorption. All these things. This is the beta, it's the most common shade that we use. Tooth color, the hue is the basic color. Yellow, red, brown, undertone. The chroma is the intensity of the and saturation of the color. The value is the brightness or lightness of the tooth. I have a picture of the value. This is high value when they're childhood, look white. Medium value adulthood, and low value when you get old. But nowadays, most people, old people, they want a teeth like this. But they look ugly. Immediately you can see they are fake. But the influence of social media and like the TV presenter, CNN, all their teeth are so clean. I think they do whitening before they go show. But it will affect the perception of our patient. And most of our patients, if they want a denture, they are old, but they want a white. Some patients want a gold on one tooth to be gold. Some patients, and we have patients who need a gold between the central incisor, a gold bar. But the white, the more people they want white thing, they look ugly. I don't think they look natural. Immediately people would say, these are fake teeth.
The people in UK, all their teeth are like
You know
that.
why?
They don't really like.
No, they have free health care, but the dental, they do just the emergency. They do the pain, they do extraction, but they don't pay for orthodontics, and so these are more expensive.
They don't seem to care about orthodontics.
Yeah, it's a culture.
Yeah.
Yeah,
They don't.
If you see, you cannot hire you in the CNN if you don't have perfect teeth.
In Japan too, they
Yeah.
don't care. They think it's so wild.
Well, the rest of the world, they don't care.
They don't.
Yeah, they don't care. So it depends on the culture. So the culture is a big deal. The movie stars always, they have great smile, although it's fake, but they have to get great smile. They would never hire you as a receptionist if you have bad teeth or whatever.
Yeah.
Translucency, this part of the central incisor, because it's just enamel. There's no dentin, so usually translucent. Aplucent, the tooth, if there's a bluish glow, this is early sign of decay sometimes. You can see abnormal because there is a tube, there's enamel rods and the dental tubules. These are basic structure of the dental tissue. They're all symmetrical, geometrical shape. So when there is a decay or abnormality, you can see something wrong from the color. And sometimes you can use the special light, the curing light, to see these abnormal. Fluorescent also, the teeth can be fluorescent under ultraviolet light. You can see them, especially on the lingual side of the anterior teeth, you can see it. And sometimes you can see if there's a crack, if there's early decay, because sometimes early decay cannot be visible. But now with the digital things, you can digital camera and digital sensor, you can see that there's decay. So the most cause of extrinsic staining, change of the stain, is food, drink, tobacco, poor oral aging. And one of the main cause of staining is I think almost the number one, is chromogenic microorganism. The bacteria will make byproducts. One of the byproducts of bacteria is stain. And if we seen dark stain, line of dark stain, the type of bacteria, they have less decay. If they have red, yellowish stain, they have more decay. This is more like statistical, more acceptable because the type of bacteria are different. So if you have a good bacteria or less invasive bacteria, they make darker black stain. While if it's yellowish, red, it's more likely because these bacteria can cause more decay. So these brown, I should put bacteria first. I didn't put bacteria, just or bad origin. I should put bacteriogenic, or they call it chromogenic because it creates chroma, creates a stain. So external stain is always going to be polished out, unless it's cause damage of decay. That would be different. That's a pathology. You have to change it. So you can polishing, stain, whitening procedure, and the bleachings. Bleaching, I have to talk about bleaching. Is a long. Did I talk about? No. Bleaching is a big deal now, but it's invasive, and they use these extra concentrated solutions, and that causes sensitivity of teeth. Intrinsic tetracycline. We talk about tetracycline, fluorosis. Fluorosis when you take too much fluoride, especially in area we have. I think the new administration they're going to remove fluoride, but fluoride is in the water. Will reduce decay. But sometimes you take external, or you work with the dentist, and the dentist give you a mouthwash, and you took more as a child because it's happened when the teeth are growing. Or you live in Colorado Springs where you drink the water from Colorado Springs where they have high fluoride content. So sometimes you see yellowish stain. But these yellowish stains, although they are yellowish, they are more resistant to decay than normal teeth because they have more fluoride. Even remember the basic structure of the tooth is hydroxyapatite crystal. With the fluoride comes, it becomes fluoroapatite crystal, which is more resistant to decay, and it's more resistant to decay, but it's more yellowish. Aging, thinning enamel, dentin, and sclerosis. Dentin sclerosis sometimes when there's a fast production of dentin, the dentin doesn't look clear or tubular. Would be sclerosis, so it would be more darker and more stained. Uniform localized discoloration embedded within a tooth structure, especially if you have trauma. So bleaching cannot be done on extrinsic unless you do root canal. You remove the pulp and go from inside. You do internal. So this is age-related. You see the abrasion? They use a toothbrush, and it's almost all the cervical part of the tooth is gone. Erosion caused by mostly acidic. The acid. People would drink more acid stuff, and nowadays we see people they do the gastric bypass. Whenever they have gastric bypass, because they make the stomach would be different. The acid will go back through oral cavity, and acid reflex, and the lingual side of especially the lower posterior teeth, there is erosion of all the enamel from inside. And attrition. With age, we have attrition. Teeth get smaller, especially if you clinch it. And also, this is gum recession and discoloration. That's age-related. The shade selection mostly with this is we use there's the steps when you have to take shade color. You have to use natural light. You don't use. This is a regular light. As much as you can do natural light. Tooth should be hydrated because sometimes if you isolate the tooth will dry. It will be different color if the tooth has natural saliva layer. Also, remove lipstick. Use natural color bibs and avoid bright clothing and reflection. But there is certain machine that can measure the color, will give you. These are digital shade matching devices. It's not that very expensive nowadays because it was very expensive. And if you have a good photograph, if you have a good digital photograph, you can take a picture of that. And nowadays, you take a picture of it, and if you have a good picture and good email it to the dental lab technician. It will help any of the dental lab technician immediately. Whenever they can do, you can write the number, but if they have another picture, it will help a lot. The biggest challenge in shade matching. Polychromatic nature of the teeth are not regular. Incisal part near the incisal edge differ from the middle part, differ from the cervical part near the gum. And the tooth should have 3 layers. The incisal part is more whiter than the middle part, than the cervical part, the gingival part. And also patient perception, that we talk about patient want a Hollywood smile, veneer, but you have to be realistic. You cannot, whatever the patient wants, and especially if you work with anterior teeth, it's very difficult to match central incisor to the adjacent. And adjacent tooth restoration, sometimes the adjacent tooth has a fillings and the neighboring has different fillings. It's all be affected in matching the coloring. So there is restoration. We have composite. So one of the main fillings we do composite, especially if the patient needs just filling or decay. The composite have different colors. You can choose A2, D2, D1. Porcelain ceramic is sometimes we use porcelain with the metal. Nowadays they use less of that because the metal will take a lot of space. And the zirconia, why the lithium's disilicate is Emax. It's very good and excellent, but it's not very strong as zirconia. Zirconia is more stronger, but it's high strength material, but less translucent. So most people you have to communicate with the dental lab technician to make the color in it, because zirconia come usually if it's 3D printed or 3D milled, you have to be hand painted. So you have to have communication with the dental lab technician, with the dentist, and maybe you could do video call and show them the color. Do you like this, or make it more red or more yellowish, more that?
Yeah, that's what I was going to ask, if you had to paint those when they were milled.
Yes, you have to paint them and cure them.
Because I was wondering how that worked.
But it takes a lot. Yeah, and zirconia is very strong when you have to polish it, and zirconia. Most of the dentists they like zirconia because it's very strong and never crack, even fell. The lithium disilicate, it's a good, very excellent in the color matching, but not very strong as zirconia. Glass enamel, no one needs glass enamel anymore. Sometimes we have to do the layering technique. Usually dental lab techniques will do layer by layer. The enamel will be, there's a dental, when you do ceramic, we do obaker, the dental layer, then enamel layer, the incisal edge will be different from the middle third, and also different from the gingival part. So this layering effect, maybe this would need one lecture about layering technique, about translucency.
But most likely they're already going to have the pre-manufactured teeth, right?
You can get that pre-manufactured teeth.
Most
it's
labs.
like a complete denture.
Yeah.
But if you want to do individual crown, you have to match the adjacent teeth. That's a big deal. Crown bridge is a more color, more aesthetic than complete denture. Complete denture, the main complaint they couldn't eat. Not the complaint that they don't have teeth.
Mm-hmm.
Although they don't have teeth, they want teeth, but they lost all their teeth. They want a denture.
Yeah.
And when you make all the teeth are the same color, it's not a big deal because they're all gonna match. Bleaching and whitening. Office bleaching, there's office and there's Zoom. Have you seen Zoom there? Zoom, it's a special light. The patient will lay down, and the Zoom the solution will be irritant to the gum, so they have to put the layer around the gum to protect the gum. And you put the solution, and the patient has sit there with a fake smile like this, and with the mouth guy to open the mouth, and they put the light in a special time, maybe 30 minutes or something. This is the zoom. But one of the main side effects, it will be the teeth will be sensitive. At home bleaching, the dentist will take impression. We have this, remember when you do the compress, we can do bleaching trays. Depends on the thickness of them. You can do bleaching trays. Because it's very cheap, sometimes the dentist will offer it for free just to bring patient. The solution is very low concentrated, so it's not gonna irritate, and they wear it at night. The patient will love it, the dentist will get more patient. The problem with non-vital teeth, non-vital, they are dead. There is no pulp. So sometimes you have to bleach from inside. You remove the film from the palatal side, you go to the tooth, remove, and you put the bleaching, and sometimes they use different type of bleaching to bleach from inside the tooth. So one of the side effects of bleaching, we have sensitivity, relapse, and realistic patient expectation. Some patients, they thought it's going to be very wide, but veneer crown. Sometimes it have to be veneer. The veneer is just the labial surface of the teeth. Crown, the whole tooth to be crowned. Also one of the treatment of staining and then. Okay, communication tips for my student. Communication with the dental laboratory. It's a team. You have to communicate. You don't send a picture, send the cost. I want this. You have to communicate. Show the picture. This tooth, this patient is female. She works there. Aesthetic is important for her. It's different from, we had an instructor, he doesn't have a tooth and he doesn't care. So these communication, show the picture, email, text the picture, email the picture of the tooth before and after, the picture of the adjacent teeth, so you have an idea of the adjacent teeth, how they look like. Patient expectation, that's these communication for very important. Cervical, middle, incisal, because the tooth is not one color. Have 3 colors, 4 colors, sometimes depends on what we're talking about. Lingual side will be different from the buccal side. If you have intraoral photograph, they are very important. Now, they have the iPhone and the new Samsung, they have a good camera. You can take picture of that. The material, also educate the patient, have discussed the patient. Avoid common pitfall, over whitening. Sometimes over whitening can cause the teeth problem. So communication is all important. Avoid poor material selection. Oh, the gingiva is very important because sometimes whitening or overextended crown or veneer can cause inflammation of the gut. Emergence trend, digital dentistry, intraoral scanner, CAD/CAM, and photography. Dentistry is now photographed. Most of the dentists now, Facebook, they have pictures of their teeth, and this is before and after. But how do you know it's not Photoshop? But they should make more videos, more than just pictures, so you can tell. And there's new, every day now and then, they will have new layers, new materials, and PEEK. One of my students she was studying the PEEK. It's a part of the ceramic type, and the hydroxyapatite is one of the new promising material. But there's always a new material now and then. All shade matching, emerging, AI tools analyze tooth color. We saw this program, you just smile and the AI will tell you which color and the size of the tooth. That's a good deal. So these are clinical examples. This is the first one, is tetracycline stain. Usually they are in one layer, usually gray, brownish discoloration. And the second case is age-related stain. The age-related teeth will get yellow with age. They get more stain. And the dark tooth, this is a dark tooth. You've seen those people. And the dark tooth will stay dark for a long time. Will never cause any problem, unless sometime will get infected. And unless they will do, you have to do root canal, and most likely you need to do crown and veneer, or crown over that tooth. So tooth color is a dynamic, enamel, dentin, and light. You have to know all these things, enamel, dentin, and light. And they have to accurate shade selection. So you have to get it's the most successful, the most suitable material to restore the tooth. Layering fix, they update digital tooth, biometric material. Always consider patient aesthetic goals to maintain. Always communicate with the patient. Tell the patient what they want, and this is the realistic that we have, and what we can expect. That's it. Come and fix it. All right.